Greetings. In this session, we will learn about the objectives of the layout design. The main objective of the layout design is to attract large number of customers. How you have to drag the attention of the public by the proper window displaying, you can do that. By proper window displaying, which enriches the business revenue. And I would like to tell you one thing, no business cannot flourish or it cannot be sustained without proper profit. When there is huge loss to the company or to any business, we cannot run the business for more number of days. So the revenue and profit is required. And to increase the sales of stores by creating goodwill in the society, so that the credibility of the retail pharmacy or the community pharmacist is increased in the society by developing a professional image. To build up an image is a very great difficult thing. To have proper entrance of coming goods, so you should make both entry as well as the exit in a very proper manner, a neat window displaying with proper entrance and exit for the customers or the patients to come in and to go out. And there should be a space for reserve stock, for the stock maintenance. And office and resting place, there should be a separate place and for office and resting place for employees who are working there in the retail pharmacy or community pharmacy. To reduce the selling expenses and provide customer satisfaction. So the main motto of any business, the community pharmacy or retail pharmacy, is to provide the customer satisfaction. Okay. To project a professional image and improve general appearance. And how to project the professional image? How to build up the professional image in the society? The building up of the professional image in the society is a very tedious and very difficult thing. That can only be created by developing the skills which you have read in the theory and how you implement that thing in the practical manner. Wearing always neat apron or white coat will develop an image, showing professional rapport with the patients and advising about drug and disease information, giving about some information about the lifestyle factors. In case of smoking, alcohol cessation and all those things, the de-addiction centers, the patient counseling areas, the patient counseling room, you provide patient counseling along with medications. You provide the lifestyle factors and you tell them how to reduce the weight in case of obesity. How to get rid of weight, by getting rid of weight, how the blood pressure is, the target goal of blood pressure is achieved only by non-pharmacological approach. There are several ways and there are several factors where you can develop and you can project a professional image in the society. Okay, which creates a good image, professional image to build up a community pharmacy in the society. To minimize the movement of customers within the premises of the drugstores. That is one of the important objectives of the layout design. The layout design should be in such a manner that you have to minimize the movement of the customer so that the work should go with smooth and efficient manner without disturbance. Okay. So the premises has to be designed in such a manner that. Now let us understand and let us move further and let us understand about design of retail and wholesale drugstores. How the retail and wholesale drugstores are designed. A modern drugstore should fulfill all the requirements as per the Schedule N of Drugs and Cosmetics Rule. So, as per the Schedule N, it states that list of minimum requirements to run a retail pharmacy, which is there in pharmaceutical jurisprudence. To start a drugstore, a minimum area of 150 square feet Okay, a minimum area of 150 square feet area is required, similar to wholesale drugstores where the minimum area is 200 square feet is required. Okay, a minimum area of 150 square feet for retail drugstore, and for wholesale drugstore a minimum area of 200 square feet is required. That is a minimum space allocated as per the Schedule N. A proper design and layout of retail drugstore and wholesale drugstore is as follows. Now we will see the proper design and the layout of drugstore. First, let us understand the retail drugstore now. We can see the image of retail drugstore here. See, we can see 15 square feet and 10 square feet. I told you 150 square feet. Okay, 150 square feet of minimum area, and we can see there is a freezer here, storage area, racks are there here, waiting area for waiting, display window, all the display window. This is an entrance where the entrance of the customers or the patients will be entering. And these are racks. At the side we can see the racks. Here there is a freezer to maintain the cold chain. Chair is provided here and table is there. Okay. So this is the typical diagrammatic representation of the retail drugstore design. Now let us move further and let us see the wholesale drugstore design. We can see on the right hand side is the wholesale drugstore where minimum area required is 20 square feet into 10 square feet, that is almost 200 square feet. That is a minimum area which is allocated to run a wholesale drugstore. Same, there is a rack provided here. You can see many number of racks because the wholesale he has to keep more number of racks. He has to maintain more number of stocks. So the area is bigger. And you can see the chair and waiting area here. And this is the window displaying this is the same entrance. So this is a typical diagrammatic representation of both retail as well as the wholesale drugstore. Now let us understand and let us go ahead and the types of drugstore on the basis of design. On the basis of design, it is classified as, the types of drugstore as classified as mainly into the 5 types. We can see here. One is the traditional drugstore, personal service drugstore, prescription oriented drugstore, pharmaceutical center, and super drugstore. Okay, these are different types of drugstore we can see here. Now let us move ahead and let us understand this traditional drugstore. Now we are looking about the traditional drugstore. Let us concentrate on the traditional drugstore. Here what happens, the entire area, this is designed in such a manner that the entire area of the drugstore is exposed to the customers. Okay, so it is designed in such a manner that all the entire area is exposed to the customers. It is having a very pleasing and professional appearance. This design is having, the traditional drugstore we are speaking, it is having a very pleasing and professional appearance. Okay, and it is convenient for all. For workers and customers, it is convenient for all, and it provides an opportunity for maximum sales. So there is an opportunity to provide maximum sales, but there are good chances of theft and other things, which is a loopholes in such traditional drugstore design. Okay. Now let us move further and understand about the personal service drugstore. In this type of design, in personal service drugstore, whole area is not exposed to the customer. But customer is required, he is required to interact with the drugstore. So the customer demands the article, where the customer can demand the article because the entire area is not exposed to the customer like in what we have seen in traditional drugstore. Only some part of area is exposed to the customer, and customer has to demand for the article. And we can see here in this area, during the purchase process, the customer demands an article where we have seen, and the pharmacist will provide the required articles to the customers. This service and design facilitates the maximum interaction between the public and the pharmacist. Okay. And here the success of the drugstore depends upon the convenient and friendly the service of the personnel who is providing that service to the customer. So how the convenience environment and friendly environment is developed by the drugstore personnel or the pharmacist over there can have a great impact on the customer. This is about the personal service drugstore. Now let us move on to the prescription oriented drugstore. Prescription oriented drugstore, the third category of the types of drugstore. When moving to the prescription oriented drugstores, these types of drugstores provide a comfortable waiting, and where the customers are expected to wait until their prescription is made available. So there is a comfortable waiting area which is allowed and which is made for waiting customers. That is one of the good things we can see here. And the prescription in this type of design, we can see health related items, all health related items like drugs, prescriptions, orthopedics, surgicals, whatever may be the appliances, all the things are kept in a separate room. Okay, all like drugs and prescription accessories are displayed in the vicinity. Okay, drugs and prescription are displayed in the vicinity, the different types of area, where other types of areas like orthopedics and surgical items are kept in separate room. So there should be no confusion, there should not become messed up. Okay. And lastly, the cosmetics and gift are arranged in a suitable area, probably in the stores. Okay, there should be probably separately stores the cosmetics and gift items, which is very much moving, fast moving consumer goods like. So it is very much required that has to be kept in separate stores. Okay, always made available. Now let us move to the one more region of the drugstores, one more classification of drugstores, that is the pharmaceutical center. In the pharmaceutical center, this types of drugstore, center, it sells the medicines, convenience articles, and orthopedic and surgical appliances. But main thing, the store has to be sufficient. It has to be having a very good space, sufficient floor space, and it should be properly decorated. Okay, so pharmaceutical centers are those, the store has a good sufficient floor space and it should be properly decorated. And here, these types of centers sells medicines only, and some of the convenience articles like orthopedic and even surgical articles also they can sell. That is different category where sufficient floor space will be available. It is very big in size. Okay, pharmaceutical centers. The last is super drugstore. Super drugstore, you can just assume, or you can take the example of the mega market, mega store, like the groceries or all the things, like we can see the mega stores, where the area is very, very big. And such type of drugstores have a huge floor area, ranging from 5,000 to 10,000 square feet design. Okay, almost 10,000 square feet square feet design is that much huge amount of area is required for running super drugstore. The customers have all the access to almost all area, just like supermarket, the customers, they go in and out, they have all the access to almost all areas, except when it comes to the prescription, there is some person who is a qualified pharmacist, and he will be he will be dispensing such prescription items to the patients. Okay, this is the types of drugstores, what you have seen: traditional drugstore, personal service drugstore, prescription oriented drugstore, pharmaceutical centers, and super drugstores.